Hello, my name's Jill Newbold. I'm one of the continence nurse specialists based down at Centenary House, and I'm going to talk to you today about toilet training your child. So this presentation is relevant for those of you who are thinking about toilet training your child, or you might have already started but want a little bit more advice. I know from experience that a lot of you find toilet training your child completely overwhelming and just don't know where to start. Okay, so in this presentation, I'm going to take you through small steps that will help you along the journey with your child. So the key points to remember today are that many children with additional needs don't show the traditional signs for readiness. And when you think about it, the skills that children need for toilet training are quite vast, really. They've got to know when they need to go. They've got to be able to know where to go. They've got to be able to find that place. They've got to be able to get their clothing removed, get onto the toilet, flush, wash their hands afterwards. So there's quite a lot of skills there that they need to develop. So one of the key messages is to start at the same time as you would do with any other child, and to think about how you might go about that. And the main focus is establishing good routines around toileting and nappy changes. So if you can imagine a ladder, at the bottom of a ladder is a child who's completely in nappies, and on the top rung of the ladder is a child who is completely independently toilet trained. So on the next ladder down from that might be a child who needs prompting to go to the toilet, and on the next rung up from the bottom might be a child who has just started sitting on the toilet. There are many rungs in between that your child might need to climb up to be able to get to the top. What we do know from experience is that some children don't always get right to the very top rung, and some children will always need prompts to be able to use the toilet. Every step that your child makes up the ladder is an achievement for them. If your child doesn't quite make it to the top rung, that doesn't necessarily mean that they won't be able to come out of nappies. One of the things that I find is that parents will often say to me, "My child's not ready to be toilet trained." Unfortunately, as I've said, some of your children won't necessarily show these signs of readiness, so please don't wait for them before you start the toilet training journey. So what signs of readiness are you looking for? One of the main things that parents often say is that their child doesn't tell them that they need to go to the toilet. And we know with children with autism that often they have difficulties with communication and won't always be able to tell them. What we do know for certain is that often children will be able to lead and point parents to things that they want, so they're communicating in other ways. And I'm sure in other presentations that you've heard, you will have had some information from your speech and language therapist around communication. So some of the signs that you might see in your child is maybe that they stop what they're doing for a few seconds and then start playing again. Your child might actually be having a wee at that point, or you might notice when they need to have a poo that they squat down or they go and seek privacy. All these are signs that your child knows what they're doing. We find that some children fiddle with their nappy or put their hands down the nappy, and again this is a sign of awareness that something maybe is a bit different happening in their nappy. You may also find that your child is dry at night or has long periods dry during the day, and these are physical signs that your child is ready for being toilet trained. So before we begin even thinking about toilet training, we need to establish healthy bladder and bowels. And what do I mean by that? Well, basically a healthy bowel is one that moves every day or most days, and that children don't struggle with constipation or have lots of loose stools. Healthy bladder is one where your child is passing urine normally without any problems. And to achieve a healthy bladder, it's important that your child is having a very good fluid intake throughout the day, and that your child is drinking water-based drinks or milk. What we do know is that fizzy pop, for example, and blackcurrant can be irritable to the bladder. We find in children with autism that often there can be issues with constipation, and this can often be due to children's restrictive diets and poor fluid intake. One of the things that we do know is that the bowel occupies quite a lot of space in the tummy and puts pressure on the bladder, and this will in turn make toilet training more difficult. So it's important to make sure your child is not constipated before you even attempt to start toilet training. Another issue that affects children with autism to do with their bowels is sensory issues. Some children don't like the feeling of pooing and don't like the feeling of it dropping out. So if your child is suffering with any issues to do with their bowels, it's important you speak to a health professional such as your GP or health visitor to get further advice. And most children who suffer with constipation may need a mild laxative. Often we find that increasing fluids and making changes to their diet is not enough. Okay, so where do we start? One of the things that we do say to start with is have an open door policy at home. And this means that you leave your door open when you and any other family members are using the toilet. And this helps your child understand what the toilet is for. What I have found as well is that lots of children where parents have a separate bathroom to the toilet, that the children never go in the area where the toilet is and become fearful of this little room. So it is important that if you have a separate toilet to your bathroom, that you encourage your child to enter that room even whilst they're still in nappies. One of the other things that all of you can be doing now is to start changing your child's nappies in the bathroom or the toilet area. And this helps your child understand the links between having the nappy changed and using the toilet. If your child is able to stand safely, please try and change your child in the standing position. Some parents find this quite tricky, but once they've mastered it, realise that it is much easier. All children who are able to stand in schools when they still need nappies changing will be changed in the standing position. And this is for health and safety reasons, because bending down over a child can cause back injuries. And also some children who kick out when they're having their nappy changed help staff to remain safe. What you will also realise at this moment in time is that it is very difficult to wait and queue for a baby changing unit, and often your children are too big to use these. So the next thing to consider is what tools are you going to use when toilet training? One of the things that parents always ask me is whether to use a potty or whether to just go straight to the toilet. And again, that's going to be down to your individual child. Some children will find it very difficult to transition from a potty to the toilet, and other children will not be really fussed by this. If you're going to use the toilet, have a think about the environment in your bathroom or in the toilet area. As we know, lots of children with autism have sensory issues, and the bathroom is a haven for lots of things sensory. Think about the unusual smells that might be in there. Think about all the distractions that are around, the shampoo bottles, the soap, all those sorts of things that may be a distraction for your child while they're sitting on the toilet. Have a think about the lighting. Some children find the lighting is too bright in the bathroom, and doing something simple like changing the bulb may help them be able to access this space. I've also had a couple of children where they have had problems going into the bathroom area, and when the parents have done a bit of detective work, they've realised that the child didn't like the cold tiles on the floor, and simply putting a mat down for them to walk on helped them be able to get onto the toilet. Think about having activities that might help your child be able to sit on the toilet for a little bit longer. An example of this might be having a bag of toys available with lots of different things in it. We know children like to fiddle with lots of different things, and a good example of a toy to help with sitting on the toilet might be a Rubik's Cube or something like a Slinky. You will know what your child likes. There are lots of different books around toilet training, and this is just an example of one. We would also suggest role-playing using dollies or teddies by sitting the dolly or the teddy on the potty or toilet to show your child what you're expecting them to do. I can give another example of a lady who said she couldn't sit her child on the toilet because the child always went to play for the toilet bowl water, and that this was putting her off trying to toilet train her child. One of the things that we suggested was for her to have a small plastic bowl with water and put a few toys in the water. The child sat on the toilet with the bowl on his knee and gave him the water to play with. Unfortunately, the child got very wet, but at least it made sure that he had fun while he was sitting on the toilet. And every time you change your child, tell them what's in the nappy. So for example, if the nappy is just wet, just say to your child, "You've done a wee-wee," And obviously, if they've had a bowel movement, tell your child that they've done a poo. At this stage, you could also tip some poo out of the nappy down the toilet and show your child that's where poo likes to go, and help them do the flush and wash their hands as part of that routine. So what do we do next? The next thing is to start and sit your child on the toilet, as we've already discussed. What I would advise is that you try and sit your child on the toilet at least once a day as part of a routine that they're already used to. So for example, this might be that they go in the bathroom for a bath, or it might be that they're brushing their teeth, so they're already in the bathroom. Try and offer them a sit on the toilet at this point. Please make sure you've got the right equipment to be able to do this, as we know that children with autism like to feel balanced, and if you try to sit them on a normal toilet seat, they might feel fearful that they're going to fall in. Please make sure you've got a trainer seat or a reducer on your toilet seat. Children will also need a step to rest their feet on so that they feel safe and comfortable. Each child has their own preference, and I have some families that have been through several toilet seats before they've finally found one that their child likes. There are also seats that have a ladder attachment, which means that their child can climb onto the toilet and also have a step to rest their feet on. It is really important that the feet are raised up and the knees are in line with the hips when sitting on the toilet. So before you start this process, have a think again about whether you're going to use a potty or the toilet. And if you decide to go for a potty, please make sure that the potty is placed in the bathroom and not in front of the television. After all, we don't use the toilet sitting in front of the TV. The next thing to think about is how you're going to communicate this to your child. So have a think about whether your child would prefer to use a PEC, prefer to use a photo or pictures of the toilet. Once you start this toilet sitting routine, it is important that it is happening everywhere. For example, if you're doing it at home, please make sure that your child also sits on the toilet if they go to grandparents' house, and we will also expect school staff to be following your routine, or you to be following school's routine. Being consistent is the key message here. So it is important that once you start doing the toilet sits, that you continue to do it in the same routine. Parents often ask me how long their child should be sitting on the toilet for, and as a loose guide, 1 minute for each year of their age. So for example, if your child is 4, we would expect them to be sitting on the toilet for 4 minutes. In the life of a child, 4 minutes is quite a long time. So if your child only sits for a few seconds to start with, that's fine. Let them get off. Praise them for sitting and their efforts. And then next time, try and encourage them to sit for a little bit longer, with the ultimate aim of working them up to 4 minutes. So if you start off sitting them once a day and your child is happy to do this and you're building it up to 4 minutes, then try and introduce another time of day when you do a sit on the toilet. And eventually we would like you to be sitting your child on the toilet every time their nappy is changed, so that they're in a routine of going in the bathroom, having the nappy taken off, sitting on the toilet and nappy put back on. And at this stage, it really doesn't matter if they don't do a wee or a poo while they're there. It's all about consistency of routines. So the next thing to think about is once your child has been sitting on the toilet and you're happy with their behaviours and their progress, it's to think about how you're going to reward them. So it's really important that you praise them for good efforts, but also think about a reward that they might enjoy. Some parents have done things like had a tube of Smarties available in the bathroom, and the child gets a Smartie when they've sat on the toilet. And this way their child knows what's coming, and it helps to motivate them to want to sit for longer. So many parents say to me that they feel their child does not have any awareness of when they're wet or when they're soiled. And sometimes we need to actually help children along with this a little bit and raise awareness for them. One of the first things that you can do is introduce the idea of pants. And these can be placed over the top of the nappy to start with, to get your child used to the idea that this is a new piece of clothing that they might need to wear. And to raise awareness of feeling wet, to put the pants on underneath a nappy. As we know, disposable nappies are really good these days, and quite often children don't feel wet whilst they're wearing them. So one of the things is to put a pair of pants on underneath. When the child gets wet, the pants get wet and they can feel the wetness next to the skin. You will then be observing for a change in your child's behaviour. Can you tell that they now know that they're wet? Are they fiddling with the nappy, or are they trying to remove the nappy? We have also seen a resurgence in recent years of parents choosing cloth nappies for their children. And what we do know about children wearing cloth nappies is that quite often they're toilet trained much earlier than children wearing disposable nappies. Also at this stage, think about having short periods of time where your child does not wear a nappy, as some children find it quite difficult to accept that they won't have a nappy on. The nappy feels like a comfort blanket to them, and therefore when you try to remove it and get them to wear pants, they feel like a piece of them is missing. The next thing that we're going to do is try and identify bladder habits. When your child is in a nappy full time, it's very difficult to know when they're actually passing urine, and so often parents have no idea how many times a day their child is weeing or whether they're weeing with a normal stream. One of the ways to do this is with the pants on under the nappy, and to check those pants for wetness every half an hour or so. It is worth keeping a chart at this point of when you've checked and whether the pants are dry or wet, but also you need to record when your child is having a drink, as that will help you to establish how long it takes for the fluid to go through the body and when they're having a wee. This will help so that when you're starting to think about removing nappies completely, you've got a bit of an idea of how long your child can go after having a drink. So for example, if you give your child a drink at 8 o'clock in the morning and they have a full cup full, keep checking their nappy half an hour after and see when they wee. And do this for a couple of days throughout the day. It might seem quite time consuming, but this will really give you plenty of information to base a toileting schedule on. What I tend to find is that most parents will start off by taking their child to the toilet every half an hour or so, but children's bladders can hold much longer than that, and children will often get bored of being taken so frequently. So it's important to try and establish exactly when to take your child to the toilet, and this will really help with their progress. Once you've got established this information, you're ready to go with nappies off. So by this stage, your child has been sitting lots on the toilet. They're happy to sit, they're happy to help you do the flush, and they're happy to wash their hands. And now you're ready to go for it. Please choose a time that's right for everyone. We might have established that it's right for your child, but you also need to establish whether it's right for you as a family. For example, if you've recently had a bereavement, it's not the right time for you, so you may well want to delay when you think about taking the nappies off. You also need to muster support from everybody around you, so that might be grandparents, it might be neighbours, it might be friends, it certainly always is school and any other places where your child might go. There's no point you doing it at home and then putting your child in a nappy for school, or putting your child in a nappy when you go out. So use your schedule that you've already devised from your detective work with your pants on under the nappy, and make sure any language that you're using with your child, the school staff are also familiar with. I often find that parents will use a variety of words for body parts, and school will often use different language, and this can be quite confusing for your child. So make sure everybody's using the same words around toileting. Once you've made the decision to start, please try and stick with it. An example I might give here is I had a lady who I went out to do a home visit. The little girl was most definitely ready to start toilet training, and I gave mother the steps to take. By Monday, I'd had a message on my answer phone telling me that it had been unsuccessful and my home visit had only been on the Thursday before, so she'd really only given it a few days. In my experience, it can take a number of weeks, could even take a number of months to get to where you want to be. Please make sure you've got all your cleaning products handy, because your child will probably be having lots of accidents, and it's important to be prepared for this. We find that children don't learn how to use the toilet until they've been having accidents and you've prompted them and told them what they should have done instead. One of the things that we often suggest that you do is, if your child has an accident on the floor, that you use a piece of toilet roll, mop up the accident and take the toilet roll and your child back to the toilet and show them where it should have gone, by placing it into the toilet for them, helping them with the flush and supporting them with washing their hands as part of that routine. Another thing to think about as well is about clothing. Skinny jeans are all well and good, but are very difficult for children to remove. So please think about having jogging bottoms or clothing that you know your child will find it easy to remove themselves. While we're talking about what help your child might need, it's important to think about, particularly for boys, whether they're going to stand up to wee or sit down to wee. And my advice would be that you always try to sit them down to start with, as boys may well then not want to sit when they need a poo. So as you can see, it's been quite a lot of hard work to get to this stage, and some parents and children will do this in a matter of months, but other children take years to get to the stage where they need to be removing the nappies. And this doesn't really matter, as our ultimate aim is for your child to be out of nappies at some point. So if it's when they're 4, that's fine, but in my experience some children take much longer and are much older when they come out of nappies. And we never give up. I've got children at the moment who are in their late teens who we are still trying to toilet train. If you feel your child is going to find it difficult to accept coming out of nappies, one idea that you might try is to have a visual countdown. So for example, you might show your child that there are 10 nappies left in the pack and count each one down each day until there's none left. And this might help your child understand that there's going to be no more nappies. Another thing to consider is not to ask your child if they need to go to the toilet, else we find that most children will just say no. They're too busy with their iPads or too busy with an activity to want to go to the toilet. After all, it's quite a boring thing to do. So it's important to just say to your child, it's toilet time. Don't give them a choice, just take them when you think they need to go. Another thing to remember is that children don't get the sensations or the signals from the bladder until it is about 3/4 full. So if you take them too regularly to the toilet, they never will experience the feeling that they need to go. So it's important sometimes to let them have accidents to be able to get the feeling of what the sensation is of a full bladder. So at this stage, thinking about rewards, it might be unrealistic to expect your child to be having wheeze on the toilet and rewarding them for that. So instead, think about rewarding them for dry pants. So we know from my experience that some children find it quite difficult to toilet train, and we also know things don't quite go to plan as we expect them to. And there can be a number of things that children find difficult in the toilet training process. One of the main ones that we see is that children find it incredibly difficult to sit on the toilet and will demonstrate challenging behaviours when they are asked to do so. One of the things that you might like to try is to sit your child on the toilet fully clothed with their nappy on and on the lid of the toilet, and this will help them feel more safe and secure. You can then progress to trying to remove layers of clothing, and then once they're used to sitting on the lid with a bare bottom, you can try and lift the lid up again and sit them on the seat. I've also found that 1 or 2 children can be even resistant to going anywhere near the toilet, and parents have had great difficulties even getting them into the bathroom. One of the things that we would suggest if this is happening for your child is to try and desensitise them to the room. And one of the things that the psychologists have recommended is that children just stand at the doorway and just look into the bathroom, and they get a reward and praise for doing that. I have found that some parents have been very ingenious and have done things like drawn round their children's feet, coloured them in, laminated them and put them near the doorway of the bathroom and asked their child to stand on them. The laminated pair of feet can then be moved very slowly into the bathroom, and eventually the child is standing near the toilet. We also have some children who are very resistant to taking their nappies off, as they are used to it, and this can be a sensory issue. If this is a problem for your child, just try having short bursts of time out of the nappies and increase this over a period of time. Some parents find that they need to replace the sensory feeling of a nappy with something else, and some parents have tried putting tight cycling shorts on top of pants, and this gives the children the same sensory feeling as wearing a nappy. You can also find padded briefs that you might find are a stopgap between a normal pair of thin pants and the nappy, and some children prefer these. Some children struggle with the communication side of things and either don't understand the pecs, the pictures or the verbal cues to use the toilet. This is something that I would always advise you to speak to your speech and language therapist about, as there may be other strategies that you can try. One of the strategies that lots of parents and school staff use is the first and then or now and next strategy. So you're instructing your child that first we use the toilet and then it's TV time or then it's tea time. And this helps your child understand that something more motivating is coming next. Another common thing with children with autism is that parents will often get them out of nappies to wee on the toilet, but will really struggle to get them to want to poo on the toilet. And again, this is a completely different sensation for your child. There is a programme that we tend to follow for children who will only poo in a nappy. And you can seek further advice from health professionals about this programme. I've talked quite a lot in this presentation about sensory issues, and again, this can be difficult for children, and often parents need further support and advice on how to manage particular situations. Constipation and bowel issues are another area where toilet training often falters. Some parents, where the child is having lots of frequent bowel movements, will use this as a reason or a barrier for not toilet training. And again, always seek advice around this. One of the key messages is don't give up. I think that what we do tend to find is that often parents will stop what they're doing because they don't feel like they're making progress. And sometimes we suggest to parents that they might want to take a break from toilet training, but we will often say, take a break for a few months and then go back to the step before that was working for you. But please carry on with your basic routine of changing in the bathroom and changing standing up wherever possible. As you can see, there are a number of times when things might not quite go to plan. My advice would be to probably seek a referral to the community continence team so we can further support and give you advice on your child's toilet training journey. Each child is different and every child will make the journey at their own pace. I've never come across two children where the toilet journey has been the same for them. Here are some resources that might help you on your journey. There are a couple of really good websites that we recommend. The first one is ERIC, www.eric.org.uk, and Bowel and Bladder UK. There are lots of resources on these websites for you to look at and for your child. There are also a number of apps that are available. Poo Goes to Pooland is a free app, and this is particularly useful for children who are struggling to do their poos on the toilet. There is also a clip on YouTube called Tom's Toilet Triumph that is a cartoon, a social story, and children really like it. If you're really struggling with the toilet training process for your child, please ask either Reigate doctors or your GP for a referral into the community continence team. Okay, so that's the end of my presentation, and my final message to you is don't give up. Lots of children with autism are successfully toilet trained and are fully independent. Some children will continue to need a little bit of support as they go through their life, but hopefully eventually they will all be independent toilet trainers.